In a previous video, we talked about how certain hip movements can allow for you to open the pelvic inlet at the top of the pelvis and also the pelvic outlet at the bottom of the pelvis. In that video, we focused more so on positions you can go into to allow for the baby to drop inside the pelvic inlet so you can better engage the baby and prepare for the birthing process. For this video, we're going to talk more so about opening up the pelvic outlet and how leg positions for that can allow for you to progress during that active labor and pushing phase. Before we jump into different positions that you can go into and try to allow for improved hip internal rotation, which will open up the pelvic outlet, I wanted to give you a visual representation as to what I am describing. So right now you can see the baby's head is engaged within the pelvis and around the ischial tuberosity location, so around the location of your sit bones. At this position, a lot of women will notice that they have that pressure and urge to push. To help allow for mom to push more effectively, simply opening the exit of the pelvis so that pelvic outlet can allow for the baby to move through with less difficulty. In order to do that, you can internally rotate the hips, so bringing those knees in or the ankles out. So for this model, I'm going to show you now internal rotation. First, this model, no rotation is present. And now I'm going to rotate. And as you can see, the bottom of the pelvis has opened up. Opening the bottom of the pelvis will allow for this baby to move through the birth canal with less difficulty. There are several ways that you can accomplish hip internal rotation. And I want to show you a few ways utilizing a ball. You can also utilize a peanut ball or even pillows as well. So one way we're going to start off with is first with you more in a kneeling position using the ball. When you come up into this position, you can have the ball in front of you. And you can first start off with both knees pointing at the ball or even slightly out. Now, if they're slightly out, you are more in that external rotation. But as you have that urge to push, you can bring the knees in, bringing the feet out to the side. And in this position as well, you can also gently rock as you are pushing. Now, if that is too much pressure on your hips, just rotate just one foot. So rather than rotating both feet, bring one foot into internal rotation, because remember, you're still able to open up that pelvic outlet as well. If you've had an epidural or you're limited to the bed, something that you can do to try to help allow for you to open the pelvic outlet is to go into a side lying position. You're able to utilize one of the stirrups to help support this leg and also allow for that knee to drop in. You can use a slightly deflated birthing ball or peanut ball or even pillows in between the ankles. It is most important that as you do this, that you rotate at the hip and not at the knee. Rotating at the knee can cause a lot of stress and strain on your knee, and we don't want to cause an injury there. So make sure as you go for that rotation that you're not just turning just the knee, but you're actually turning through the hip. Utilizing this in this position can allow for you to open up that pelvic outlet. So now you're able to remain in the bed, stay safe, and also allow for the mechanics of labor itself to take over and allow for the baby to exit the birth canal. There's some women who feel more comfortable giving birth where they're in an all-fours position, more like a crawling position. If that's the case, you can utilize that position as well to allow for internal hip rotations. So when you go onto your hands and knees, instead of allowing the knees to come out to the side, so now your feet are closer, you're going to move the knees closer together and bring the feet out. Now, if you're noticing having the knees touch is too much pressure, you can simply bring both legs a little further apart from one another and then turn the feet out, so that way you're able to still maintain that hip internal rotation and also put less stress and strain on your hips. Just as we did before with the ball, you're able to rock through this motion as you need to, which can also help as you are pushing to allow for your body to utilize gravity and your breath to allow for baby to exit the pelvic outlet. Now that you know some positions that you can use to help open up the pelvic outlet to allow for the baby to exit as you're pushing, go ahead and give these a try. What you don't want to do is you don't want to wait till last minute to try these, because if the time comes and you're not comfortable in a position, you at least want to know other positions that you can go into. So go ahead, give them a try, and let me know your thoughts in the comments.